Hey everybody, it's Friday morning and we're getting ready to start a new semester and I'm sure that there are very few people who don't realize there's a major surge going on with regard to COVID-19 in our community and in our state. It's not quite out of control, but it's close to it. We have 11 cases this week, counting students, staff, and faculty. And, that's the highest we've had in, first time we've hit double digits for a week in quite some time. And, this Delta variant has come back with a vengeance. And it's more or less thought that it'll die out in a month or so or a little more. But, there'll be another variant that follows that. And in fact, there's already 2 or 3 that we're expecting to make their way to the United States before very long. So, I hate to be right about something, but I've been saying that we were going to have these issues because these variants may be more deadly, less deadly, more contagious, whatever. But they have properties that the original coronavirus might not have had. Now, there's only one protection that you can take at this point in time. I mean, you can shut yourself into your room and not leave it for the next 6 months. Or year and a half, or ever how long this takes. The other option you have, unless you have some medical issues associated with taking a vaccine such as this, you can get vaccinated. And we have a mandate in our state that we're not to require vaccinations. If there were not for the mandate, I would require them of all our student, faculty, and staff, but that don't have either religious or medical reasons otherwise. But I can't. But I can encourage you, and if you care about your own health and the health of your loved ones and the health of your friends and the health of the community, you need to get vaccinated. And we need to get that done before, it takes about a month, depending on which vaccine you get, anywhere from 3 to 4 weeks to get fully immunized against this virus. So, I'm getting a little agitated because, we knew this was coming. People quit getting vaccinated. People quit taking precautions, quit washing, sanitizing their hands and wearing masks and all the things that are necessary to try to protect yourself. And this can be deadly, even though it's not as, apparently the Delta variant's not as deadly as the original. But I don't know if there's enough data in to say that yet. But there are people dying from it. There's certainly people that are being hospitalized. There are people that are missing work for a significant amount of time. And to go along with that, you feel pretty bad. And no one likes the flu. And it's a bad case of the flu in many instances. So you don't want to go through that. And you don't want your loved ones to go through it. So I want to make sure you understand the significance of not getting vaccinated, because right now the herd immunity idea isn't working. And I'm on the Council of Presidents of the NCAA, and their chief medical officer told us this day before yesterday that, the herd immunity, because of the variations of that are taking place with the various viruses, with this particular virus anyway, the herd immunity is not the save-all that we thought it might be. If you can get vaccinated, if you don't, and it's free to get vaccinated. The vaccine is plentiful now. It is not that you can't find it. It may be a little more difficult than you would like in some areas, but in general, it's not nearly as difficult as it was. And you can almost go down and get in line to get vaccinated in many, many places. So if we don't do that, we're going to have a real difficulty when we start fall semester. Easily could have something that brings us to our knees. I would say that in some ways we're more in less charted waters this year than we were last year. And I want to encourage our students and faculty and staff to understand that, we had a plan today. Could easily be different tomorrow. Flexibility is the secret to being able to deal with these things. And but one thing that we are inflexible about is that everyone should be vaccinated if they can. And if you do that, the opportunity for you to contact the disease goes way down. And the fact, if you do contact it, the severity goes down even more. So please, be patient with us. We consider the ramifications of these things every day. And it's because every day when the sun rises, we have a new day and we have a new set of issues associated with this pandemic. I encourage you, I beg you to consider getting vaccinated, and it doesn't really hurt much. There's a few little symptoms that may go with it, but it's well worth having a sore arm and maybe a little bit of temperature rather than getting COVID-19. So don't want my messages to always be so harsh, but things are getting a little bit out of hand, and they can get out of hand even worse rather quickly. So I'm looking forward to the fall. I'm looking forward to seeing the students come back. I'm looking forward to meeting a few parents here and there, and we will be starting classes, in-person classes. People will be wearing masks. The faculty wear masks. The students are going to wear masks. So we have an indoor mask requirement right now. So we're not saying face-to-face anymore. We're saying mask-to-mask. But it's well proven that the students that attend class, as opposed to doing their work remotely, learn more, benefit more, do better in the assessment of what they've learned, et cetera. So come back to school, go to class, participate all you can. Just keep yourself safe. Wear the mask, stay out of crowds, sanitize your hands, don't put your hands near your face. All the things we were doing before, we're going to have to do them again with even more vigor. So, first step, get the vaccine. Thank you.